Hi, my name's Dave Rogers, physiotherapist working on the Back to Life programme. I'm going to talk to you a little bit about activity management. We know that back pain really impacts on people's lives. Their ability to do the things they want to do often gets really compromised, but sometimes they might have days where they can do lots of activity and feel okay. But the general picture with back pain is that people get frustrated with either not being able to do some of the activities they used to do, they used to enjoy, activities that really made them tick, or that on some days they can do lots of activity and other days they really can't do much at all. We recognise often with activity management there's two patterns that people get into, one of which we call the boom and bust or over-under activity cycle. The other pattern that people get into is what we call the avoidance cycle. It's natural when we have pain to feel like our body needs protecting. That can be really helpful with acute pain, when we've injured something, for example. But often with back pain, we recognise that there's a group of people that become very avoidant of activity. Because we know that pain is a protector, often when it persists, if we keep protecting ourselves, our body starts to become deconditioned. Muscles get tighter, ligaments get tighter, muscles get weaker, our joints get stiffer. And the result of that is we struggle to work, we struggle to do activities we normally enjoy, our sporting activities, our leisure activities. Undoubtedly, this will have an impact on our mood. It will make us feel fed up. We would withdraw from activity. We might get angry. We might get frustrated with people around us. We might feel under pressure from employers to get back to work when we don't feel ready. And we get stuck in this cycle of inactivity. This can be really demoralising for people with persistent back pain. But we're confident on this programme, through the hundreds of patients that we've seen and all the clinical evidence out there, that there is an approach that can help you to get back to the activities that you want to do. Firstly, it's helpful to understand what pattern you are into. When you have your pain, do you avoid activity? Do you recognise that you've become much more protective of the activities that you used to do? If that is the case, you've probably become what we call fear avoidant in terms of your activity management. We recognise that although things hurt, by starting to exercise at a low level of activity and building it up gradually, safe in the knowledge that you're not going to cause damage to yourself, you'll notice some real improvements in function. You've had an assessment before you came on the programme to check that it's safe for you to exercise. And all of us who work on the programme are confident that movement and activity will help you. You'll often feel worse to begin with. It'll hurt more. It'll feel like the wrong thing to do. And it's very easy in the early stages to back off exercise. But we really encourage you to work with it, starting at a low level and building it up gradually. Usually over a period of a few weeks and months, you'll notice that those activities that you've kept away from, you can start to do. Maybe not at the same level as you could before, but as you work on it over time, you'll find that your function will start to improve. So if you recognise that you become avoidant of activity, there are some really helpful approaches we can use on the programme. The other group of patients we recognise are what we call the boom and bust, or the overdoers. These are people that on some days they feel they can climb a mountain, they can swim a lake, they can run a marathon, and then on other days they get completely floored by their activity. They become very inconsistent in terms of how they can do activity. They feel their pain is very unpredictable, and they really struggle to have any consistency to their life. One of the main errors that people make with the boom and bust approach is that on the good days they overdo it, and on the bad days they can't do anything. Again, there are some strategies we can use to help you with this. So first of all, when you're thinking about how to apply activity management through the Back to Life programme, it's important to understand that you need to pick an activity that you've been keeping away from and start at a nice low level. Make it easy on yourself to begin with. Don't go too hard. Start to do that activity at a nice low level to begin with. It might be, for example, walking. You may struggle to walk for 15 or 20 minutes. It may really hurt your back to do that. So what we tell you to do is to start with maybe a 5-minute walk regularly. Do it every day. And after every third or fourth day, increase it to maybe a 7-minute walk. Continue with that for a few days and increase it again, maybe to a 9 or 10-minute walk. Remember, you may feel worse to begin with, but as you build things up gradually using a stepped approach, you'll notice that your body will feel better. You'll feel more flexible, you'll feel you'll move better, and you'll feel more confident. And more importantly, it will lift your mood. If you recognize that you are an overdoer, that you push yourself too hard, it's really important when you wake up on a good day that you don't overdo it. One of the common errors that people make when they're in the overactivity cycle is that on the good days they do too much. So often that can be a warning sign. If you wake up and your pain doesn't feel too bad, don't feel like you're going to push yourself as hard as you can through the day, because you know that will cause a flare-up. On a good day, if you're an overdoer, try and pace yourself. Try not to push yourself too hard. And on a bad day, try and do a little bit more than you'd normally do. So one of the key principles of activity management is knowing where your baseline is. How much do I feel I can comfortably do without feeling like I'm overdoing it, and also without feeling like I'm avoiding things too much? Establishing your baseline level of activity is the key to being able to improve your function. And it can be quite a challenge to work out what your baseline level of activity is. Okay, so in reality, we recognize that it isn't black and white in the sense that you're either an avoider or an overdoer. We recognize that people often have a bit of both. It may be certain activities you become more avoidant, and other activities you overdo it. So recognize that you might have a bit of both of these aspects going on when you look at activity management. So to sum things up, ask yourself the question, do I protect myself from my pain? Have I become avoidant of activity? Do I push myself too hard? Do I do a bit of both? And then we can start thinking about how to establish a baseline level of activity and how you can then go about improving it.